Okay, now, this next part, I'm going to talk a little bit about the techniques that we use these days to move people along the continuum. And I'm going to compare that to what I did in my own life. I was kind of my own therapist, sort of. So, a while back, at the halfway house over there, this is actually before, was it before it was Woodland Intensive Residential? Doesn't matter. As a director, I'm like the principal, so if people are naughty, they send these poor unfortunate folks to me. I'm supposed to sort it all out. And one of my staff said to me one day, I got pretty good at it after, doing it for 7 years. And so one of my staff said to me, what the hell do you say to those people? They go in there, they're all bent out of shape, and they come back out, and it's like they're just mesmerized almost. And I didn't really know how to answer her. And I thought about it, and they said, well, mostly I just listened to them. And when you think about it, what a unique experience for somebody who's been led around, people telling them you have to do this, you have to do that, they take you to court, they say you have to go to treatment, and then they go to treatment, and the treatment people say, well, you have to do this and this and this. And along comes, Goofy me, who says, oh, what's going on? And then I actually listened to him. Apparently, they were impressed. But what I didn't know is that a couple years later, I attended this workshop at Door County, Wisconsin, which I'm just going to plug that, Door County, Wisconsin, go there if you can. It was Don Meichenbaum, who was kind of one of the originators of cognitive behavior therapy, which basically cognitive behavior therapy says that there are these internal events called thoughts, which in turn cause external behavior. So if you want to change the external behaviors, you should work on changing the thoughts. Really quite simple. So he's talking about cognitive behavior therapy, and I'm sitting there, I do that, and I do that, and I do that. I've been doing cognitive behavior therapy for years and didn't even know it. So he has what he calls the 7 tasks of the expert therapist, which is you develop a collaborative therapeutic relationship. Now what he said, he was, and if you get a chance to see Don Meichenbaum, and he's out, because he's retired from his college job now, and he's out doing workshops all over the place. Well, if you could go to one, go see him. He is able to quote an unbelievable amount of study data, because that's what he did for years and years. The collaborative therapeutic relationship is the most important component in a working relationship with a client. It's the most important component as far as success of therapy. I think it's now, in my case, I was inhibited because, being my own therapist, that I had low self-esteem. It took me a while to get things going. But as I started to feel better about myself, things went better and my recovery speeded up quite a bit. Educate the patient about his or her problem. And by the way, this isn't a sequential thing. This can happen, when we're working with clients, this collaborative and therapeutic relationship develops the whole time that they're there. I did a lot of studying about what was wrong with me. And I got a lot of information from books, a lot of information from, TV. Used to stay up and watch Todd Snyder. Do you remember Todd Because I figured I should, you know, I'm a smart guy. I should be able to figure out how to fix this. I guess I did eventually, but. Now, you help the patient reconceptualize his or her problem in a more hopeful fashion. And I did this to myself, but when we do it to our clients, it's, you know, maybe they'll tell you about some terrible stuff that happened to them. Maybe they were in an abusive relationship, or you know, their loved one died and their house burned down, and, you know, on. So then you say something like, how did you get through that? And they start telling you about their strengths, even though they don't know they're telling you about their strengths. And it's not really a problem. Now, this speaker this morning, this Judy, what a perfect example. She was her own therapist, reconceptualizing, you know, it's like, you know, so she gets to the point where she doesn't realize she has a disability, even though clearly she does. Ensure that the patient has scoping skills. You know, we have, in our program, we have a coping skills group, and we work individually with people on it. Well, what coping skills have you used? Oh, it's really, really bad today. Well, what coping skills have you used? Your skills. And like any skill, you can learn them. Encourage the patient to perform personal experiment. Now, keep going back to this guy, because this was just a cool moment for me. Because I said to him, why did you risk talking to your, you know, what gave you the idea? Well, he said, you know, the stuff you're talking about here, it's, you know, you got to get that, you know, talk about things the way they really are. And like, yes, I do it to somebody. Woohoo! So he went and he performed an experiment, and, you know, it went so well. Then he did it a couple more times while he was on pass, do a couple more. He came back and he was just kind of glowing. It's like, close your eyes, close your time, but you should see what happened. I talked to these people. It was really cool. Ensure that the patient takes credit for change. I had this experience for a while. I was illness management recovery consultant for the state, and one of the things that we did, we would go to agencies that had received this training from the state and do a fidelity visit, you know, see how closely to the model these people are providing these services. And, you know, lucky me, I got to be the guy to interview the clients. I love that. I love talking to the clients. So I'm talking to the client, and it's this woman who had, I forget how many kids, several, and she had been homeless with several kids. And when they started working with her, she worked through this thing, and she's got all this stuff going on now, and her kids are doing good in school, and she's, you know, the future looks bright. And the whole time she's talking about her, I think it was an arms program, so she's talking about her arms program, you know, and she did this and she did that. And so it occurred to me, well, who is she attributing all this to? So I asked her. I said, geez, you know, you went from there and you're doing really good now. Who's responsible? She had to think about it. And then her face lit up like, me, it was me, I did it. She was all excited then. But oftentimes, people will, you know, if you're working with someone and you're kind of an authority figure, you know, they'll say, oh, you were fabulous, you know, you're just the greatest. Well, no. They're the ones that have to take those kind of risks over there. We just, you know, shout advice from the sidelines. And in my own case, for some reason it occurred to me that I had to look at my recovery and say, well, you know, remind myself that I did it. I'm the one that made the hard choices. And conduct relapse prevention. This is something that, you know, we talk about quite a bit in our program. You know, what are your warning signs? When you see the warning signs, what do you do? Who do you call? That kind of thing. I have my warning signs. I watch for them. I haven't seen any for a while, and I'm pretty happy about that. But it can come back. You know, if I don't do things the way I need to, you bet. Okay, motivational enhancement. This is not enhanced interrogation techniques. There's no waterboards involved. Otherwise known as motivational interviewing. Now, this comes out of the chemical dependency tradition. But what I'm saying is, this is stuff that people need to incorporate. You know, all of us, when we go home, we need to incorporate this in a thoughtful way in our lives. Because not only, well, I'll finish that in a bit, but, you know, the basic idea is that people with distress want to lessen that distress. So, you know, if you've got a guy, you know, we have these people who are very chronic, you know, they're in detox, you know, regularly, and maybe they've been in our program 3 or 4 times, and then, you know, they get cleaned up pretty good, they're looking pretty good, and we can't keep them anymore because they don't meet the continuing state criteria and so forth, and out they go, and, you know, a week later they're in detox, or 2 days later they're in detox, or in the emergency room because they, you know, drank way too much. They know they're miserable. Even they might tell you, "Oh, I'm good. I you know," but they're not. They know they're miserable, and they would like to be less miserable. So if you listen to them with a positive and non-judgmental attitude, they will tell you where it hurts to the best of their abilities. So this goes back to that everyone needs unconditional acceptance, which just Lair said that's the most loving thing one human can do for another, is unconditional acceptance. So when you're talking to your clients or your patients, whatever they tell you, unconditional acceptance. Now, sometimes you have to get through the layers, so the first thing they tell you is a bunch of BS. And you go, oh, well, that must be hard for you. You know, this old, the old CD tradition, it was very confrontational, you know, and you see the one guy and he's shouting at the other guy, "You're an alcoholic and you'll always be an alcoholic." Nobody likes that kind of treatment. And who likes to be told what to do? I don't. Nobody likes to be told what to do. Is there anybody in here that likes to be told what to do? I'm not seeing many hands. I've been a supervisor for most of my adult life in one place or another. And sometimes I had to supervise people that had a lot more technical knowledge about the job we were doing than I did, which was sort of intimidating to me at first, until I figured out that nobody likes to be told what to do, but people really dig it when you ask them what to do. "Could you do this for me? You know, I got this thing going over here. Could you take care of that?" "Oh, thank you."